Okay, so I'm going to be explaining the vibratory positive expiratory pressure therapy, or PEP therapy. This is just an alternative to the postural drainage and the percussion techniques for bronchial hygiene. So the first thing I would do is obtain the PEP device and set it up with a manometer, which is just going to measure the pressures throughout the therapy. And then I'm going to wash my hands, introduce myself to the patient, and explain the procedure to them or the therapy to them, and explain the purpose for it and make sure that they understand that. And then I'm going to assess the patient. I'm going to make sure that I note their vital signs, their mental function, and their skin color, as well as their breath sounds, which this is just going to give me kind of a baseline to go off of as I am monitoring them throughout the therapy. And then I'm going to adjust the fixed orifice on the therapy device itself to the largest setting and make sure the patient is sitting upright. And I'm going to have them sit upright and their elbows on a table in front of them, and I'm going to place the mask over their mouth and their nose tightly, but make sure it's still comfortable enough for them to wear and not too tight. And if I'm not using a mask, I would use a mouthpiece and make sure they have a tight seal around the mouthpiece and adjust their nose clips. Then I'm going to instruct the patient to take a breath, but make sure it's a larger breath than they normally would take, and exhale that breath slowly. And I'm going to observe the pressure that is generated during that exhale, and I will decrease the orifice size until it is about 10 to 20 centimeters of water pressure generated during an exhale. And then I'm going to note the patient's response to that. Then I will instruct the patient to take 10 to 20 breaths, followed by 2 to 3 huffs, which is a forced expiratory technique. And then in a clinic setting, this would be performed 4 to 8 times for 10 to 20 minutes, and I would reassess the patient periodically. And after the therapy is over, I would note any sputum that is produced, the color of it, the consistency of it, and the quantity of it. And I would also note if there is any blood produced.